So I start out and I get my supplies ready. I have the universal wipe remover, skin protective wipe, or the bottle of adhesive, a few Q-tips, always come in handy. This is my barrier extender, and then I have the 2-piece 3778 pouchkins, and then I have a barrier ring and some stoma powder, and I didn't really do those in the order I'm going to use them. So we come over here, we have a clean baby with dry stoma area, and he has a little bit of redness. Even sometimes when he doesn't have redness, I'll add some stoma powder. Oops, I have to distract him. Okay, so just a little bit. Try not to get it all over the stoma. I just kind of get it as close as I can, and then I'll use a Q-tip and kind of move it around where I need it. And you can blow off the excess or wipe it off with the Q-tip. Alright, once that's done, if you use skin protective wipes as your barrier adhesive, you would unwrap this and blot it on, but I use the bottle of Skin Tack adhesive so that I can get a thicker coating, and I just go around where I want the adhesive, where the wafer is going to stick, and I just go around it a couple of times to get a good saturation. And then after that, it's good to have a blow dryer handy and just kind of apply some light heat until it's dry. You want to get that really dry. That's really important for the next step, that is very dry. Okay, then I like these barrier rings, the 7805 polyester. So just open one up. You're going to pinch off as much as you'll need. I need kind of, a quarter of it because he has a stoma and a fistula. And then you just mold that into like a worm. I like to try to get mine as thin as I can. And my hands are sticky, so it's kind of hard. Okay. Now all of this, you could go ahead and have this prepared before you even begin, which would make your process a lot faster. Okay, so that's about as much as I need, and I'm just going to start kind of in the center and go around the stoma. And then I also bag his fistula. Some people don't, or some people like to put a piece of tape over their fistula, but I like to just bag his. And I'm going to put a little bit more so that I get all the edges doubled on around the stoma, because this will really help with leakage. This absorbs so that you won't have as many leaks, and it kind of just, doesn't have to be perfect, just kind of like that. Okay, then I take my barrier, not barrier ring, it's the wafer that comes in the 2-piece system, and I already have his pre-cut. To make it a little faster, I heat it up a little bit with my hair dryer over here away from the baby. That will help it adhere a lot better, and make sure it's cool enough that it doesn't burn the baby. But and if he'll let me, I'm gonna have to switch hands so that he'll be distracted. There we go. Oh, and he threw it. Okay. Alright, and then you just stick that on, and remember I had some Q-tips. This is another reason that I like to have some handy Q-tips, because if you gently press around to get the bubbles out and kind of get it where it lays a little flat, it will last a lot longer. Then you're less likely to have a leak. So just kind of gently get all the bubbles out, make sure that it's stuck on the adhesive really good. Okay, and then sometimes I will use a barrier extender. I didn't grab my scissors, let me grab those. This will also make your bags last a little longer. Let me find the scissors. Okay, so let me hand him this. Here, buddy. So what I do is I just cut kind of how I need it. I mean, you'll know where they mostly have leaks. His are sort of on the right side, so I'm just gonna kind of cut a little strip to go over here on this right side where he normally has leaks. Okay, and that just kind of sticks right on there like that. And now we're ready for the bag. Peel this off, and I like to kind of apply his out to the side so that it's easier to drain it. And there we go. Kind of make sure you have all the air bubbles out. That also makes a big difference for leaks. And there's our new bag.